Hi, my name is Jamie Lozano. I use he, they pronouns, and I am a master's student at Arizona State University online. Today, I am going to be providing a broad overview on bridging the gap, providing competent medical and mental health care to transgender individuals. Before we get too far into this presentation, I feel as if I cannot do this subject justice without addressing the recent rise in anti-transgender rhetoric, especially within the United States. In the first few months of 2025 alone, the Transgender Legislation Tracker has recorded proposals of more than 600 bills over 48 states to limit transgender access to health care, modify education about gender, and more. Additionally, the Trump administration has removed pages from the United States federal websites and has quickly been progressing in the dissolving of diversity, equity, and inclusion programs. I acknowledge this not to discourage our community, but to ensure that we are informed and to further encourage transgender people and allies alike to continue the push for education and conferences like this one. Now for some basic statistics. According to the University of California, Los Angeles Williams Institute, the United States has 6.5 million people over the age of 13 who identify as transgender as of June of 2022. According to Statistics Canada, as of May of 2021, there were 59,490 people in Canada over age 15 who identified as transgender and 41,355 who were non-binary. Providing competent care acknowledges the difficulties in data collection for the transgender and gender nonconforming population. Like many minority groups, the TGNC population is a hidden population, meaning they are very difficult to research. This occurs for a variety of reasons, but most frequently occurs due to a distrust of authority figures such as governmental agencies and researchers. Additionally, the TGNC population has historically been pathologized when receiving healthcare and face both verbal and nonverbal discrimination in their day-to-day lives. The intersection of transgender identities and other minority populations, i.e. people of color, can result in stronger resistance to participation. Dr. Schumer, a pediatric endocrinologist at the University of Michigan, Ann Arbor, notes that youth of color were more likely to identify as transgender and gender nonconforming, which adds another stressor. The intersectionality or combination of multiple identities, including minority identities, can make the transgender population at higher risk for mental health symptoms. Another important acknowledgement when providing competent care is to address one's own implicit biases. Implicit biases, as defined by the Harvard's Project Implicit, are automatic mental associations that operate below our conscious awareness, subtly shaping how we perceive and make decisions. Addressing these biases, while uncomfortable at times, can make care providers more informed about their own decision making and ensure they are providing the best resources for their patients. I chose 2 research articles to look at suicidal ideation and non-suicidal self-injury, specifically within the United States and Canada. In Veal et al.'s 2017 study, they discovered that for Canadian youth, transgender people ages 14 to 18 years old had 5 times the risk of suicidal ideation, with 2/3 having seriously considered suicide in the past year compared to their cisgender counterparts. Additionally, 19 to 25-year-olds had 8 times the risk of suicidal thoughts compared to their cisgender counterparts. In the United States, Rachel Dowd in 2023 found that 81% of transgender adults in the US have thought about suicide, 42% of transgender adults have attempted it, and 56% have engaged in non-suicidal self-injury over their lifetimes. With these figures and the current political and social climate in mind, it is more important than ever to ensure that transgender populations are well supported in their medical and mental health care. With the statistics from the previous slide in mind, Hudo et al. In their 2020 study stated that more sources of gender affirmation that transgender people are able to access, the better their mental health. This statement further supports the idea that gender-affirming care can be protective against adverse mental health outcomes. Sources of gender affirmation can include social support from family, friends, and colleagues, which can include using the proper name and pronouns, medical support, such as starting gender-affirming hormone therapy or surgical intervention, and other community support, like going to support groups with other transgender individuals. Hudo et al. Also discovered an inverse association between gender affirmation and mental health indicators for the transgender population in the United States. More specifically, the participants, which were 288 transgender and gender nonconforming adults surveyed in 2015, reported a lower frequency of non-suicidal injury and suicidal thoughts and behavior after initiating gender affirmation care, either via social or medical transition, as compared to before their gender affirmation journey. While further research is necessary to examine the before and after of care, Retrospective self-report studies provide researchers an important stepping stone to further research on this population. Additionally, these researchers found that identity disclosure, i.e. social and gender disclosure and affirmation, and medical gender affirmation, such as the surgeries and silicone injections, were inversely associated with anxiety, depression, and stress symptoms, suggesting that these measures are protective for transgender individuals. Here are a few key takeaways for care providers. First of all, providing a safe space. For some transgender individuals, and especially transgender youth of color, having a space where their identity, including name and pronouns, is respected can make a world of difference in feeling recognized and safe. Providing a safe space can be challenging at times because that does require addressing one's own implicit biases that doctors and therapists may not initially be aware of. Additionally, working towards understanding and not pathologizing means treating each patient as an individual as a baseline in medical care, as well as coming in educated. Transgender patients often complain that they need to educate their providers, and they should not need to educate their provider on basic transgender terminology or care. Instead, providers should be aware of what a transgender patient needs and provide them with supportive care. Although this presentation is quite brief, I have some other recommended resources, which include the recent publication of Care Without Pathology by Dr. Hansman, the Transgender Training Institute, which is run by transgender educators and is set for many educational settings, GLAAD, the world's largest LGBTQ media advocacy association, the American Civil Liberties Union, the Trevor Project, which is focused on transgender youth and LGBTQ suicide prevention, and the Human Rights Campaign. Thank you for watching my brief presentation on Bridging the Gap. Here's some more information about me and how to contact me if you have any further questions or any other research interests that align with this presentation.